Good evening, ladies and gentlemen. Welcome to yet another interesting topic, high blood cholesterol treatment. I remember my humble self, Lucky, Dr. Drugs, and I have the pleasure to be presenting this health topic today, bearing in mind that this health topic affects everybody we know on earth, and we'll find out why shortly. That's me, Dr. Drugs, and the table of contents goes thus. We can't talk about high blood cholesterol without knowing what cholesterol is. And of course, the types of cholesterol that are available should be discussed. Lifestyle diseases are important in this topic. We're going to know why shortly. High blood cholesterol itself as a topic of discourse for today. Then we have the signs and symptoms, causes and risk factors, complications, diagnosis, epidemiology, prevention of high blood cholesterol, management and treatment, and so on and so forth. Without much ado, I'd like to bring to our notice once again, I always do this, I'd like to always point out that the greatest assassins on earth are not the ones we know. They're not 007, James Bond, or Tom Cruise in Mission Impossible, so on and so forth, but cholesterol and stress. These are responsible for the highest number of deaths in humans. And cholesterol deposits generally block blood vessels and lead to cell death and or tissue damage. On the other side of where the blood vessels are supplying, this is basically what is called ischemia. Ischemia simply means cell death as a result of hindrance of blood flow through the arteries of affected cells, leading to lack of oxygen and food to the affected cells. Of course, they die in the process. As we all know, stress leads to an increase in production of reactive oxidative species that attack DNA, and that's why antioxidants are actually very important, because they are notorious for countering the negative effects of these reactive oxidative species. So what is cholesterol? Sometimes people hear cholesterol and think it's a very toxic substance that is not important for or vital for life. But on the contrary, cholesterol is super important for humans to survive. In fact, cholesterol is defined as a type of lipid or fat or waxy substance mostly produced by the liver and is essential for maintaining cellular structure and function. It is found in every cell of the body and plays a vital role in various bodily functions, which includes cell membrane structure, hormone production. Can you imagine that cholesterol is a precursor for sex hormones like estrogen and testosterone that give us our various sexual characteristics? Vitamin D synthesis, that is the sunshine vitamin we know. It also facilitates fat digestion and absorption, because cholesterol is one of the components of bile that is produced in the liver, and bile helps to emulsify fat and help with digestion and absorption of fat. The brain consists of about 23% of the body's total cholesterol. Guess why? Cholesterol, of course, is an insulator, and this helps to insulate the nerves which conduct electrical impulses in the brain, and that's what makes us self-conscious, control our muscles, and other biological processes and functions that take place in the brain. We have these cells called oligodendrocytes that produce myelin sheaths that insulate these axons of the nerves that help to conduct electrical impulses and information in the brain and all over our bodies. And this myelin sheath helps to insulate the axon, and of course, this will ensure proper conduction of nerve impulses all over the body, as well as in the brain. So you can see that cholesterol is so important that we cannot even do without it. So cholesterol is so important that it is produced by every cell in the body to different degrees. Our liver cells produce about 80%. Intestinal cells 10 to 20%, kidney cells 5 to 10%, and the brain cells actually produce about 2 to 5%, and other cells in the body from 1 to 5%. This is just a simple pathway of how cholesterol is produced in the body for those of us that are science inclined. I just want us to bear in mind one particular point here, and that is statins. Let's take note of this. We can see that in the pathway that involves the production of cholesterol, or the pathway that leads to the production of cholesterol, we can see that these statins, or 3-hydroxy 3-methylglutaric coenzyme A reductase inhibitors, actually hinder the production of mevalonate, which is a precursor of cholesterol in this pathway. And that is why we have drugs like atorvastatin, simvastatin, and all that to help prevent the production or pause the production of cholesterol or excessive production of cholesterol at that point in this pathway. And that's why this picture is actually important. Then we can see different types of cholesterol. We have the low density lipoprotein or bad cholesterol. It carries cholesterol from the liver to the cells, and excessive levels contribute to plaque or cholesterol aggregates buildup. We are hearing about people having cholesterol in their blood vessels. This is the guy that is responsible for that. And that can lead to ischemic stroke or cholesterol aggregates blocking blood vessels in the brain, leading to brain cell death, peripheral artery disease, central retinal vein occlusion in the eye, that's CRVO, and so on and so forth. In fact, cholesterol can actually lead to problems in the eyes when it's excess in the blood. Now, we have high density lipoprotein, which is actually the good cholesterol. And you can see that it actually moves these fatty substances and cholesterol, excess cholesterol, from the blood vessels and the cells of the body back to the liver to be processed. And that's why it's very important. We'll see shortly when we're talking about lipid profile. We see why this is very important. Then we have very low density lipoprotein. In fact, it is very bad cholesterol and it's similar to LDL and notorious for what's also transferring what we call triglycerides, which are also fatty substances that can be detrimental in excess. So lifestyle diseases are important to know about because cholesterol itself in excess quantity in the body is indeed a lifestyle disease. That's hypercholesterolemia or high blood cholesterol is a lifestyle disease. And that's why we have to talk about this. So examples of such lifestyles that can provoke or lead to lifestyle diseases includes lack of physical activity, poor dieting, alcoholism, smoking, substance abuse, lack of rest, and other lifestyle choices that can be bad for us. Now, these lifestyle diseases include high blood cholesterol, which is what we're talking about today, fatty liver disease, cardiovascular diseases, atherosclerosis, obesity, type 2 diabetes, ischemic stroke, and so on and so forth. And they sometimes combine to form a team that leads to what is called metabolic syndrome, of which high blood cholesterol is part of that team. Bear in mind that prevention of these lifestyle diseases entails avoiding the avoidable risk factors. Lifestyle diseases move together often, and it's more like all for one and one for all. That means one lifestyle disease can lead to many other lifestyle diseases, and lifestyle disease can emanate from many or one or two or more other lifestyle diseases. It's just a web of lifestyle diseases working together and diligently to bring the human race down. Now, lifestyle diseases are mostly reversible, but guess what? As with most disease conditions, the earlier, the better. Ladies and gentlemen, we have arrived. High blood cholesterol or hypercholesterolemia. It is excessive detrimental accumulation of all forms of cholesterol except what? The good cholesterol or HDL in the blood. It is a lifestyle disease, and bear in mind that it is treatable. So are the signs and symptoms. High blood cholesterol often has no noticeable symptoms until severe complications arise. However, here are some potential signs and symptoms which include no symptoms at all, as aforementioned, mild fatigue, shortness of breath, we'll find out why shortly, dizziness or lightheadedness, it is blocking blood vessels in the brain, of course, we know that could be a problem. Pale or yellowish skin, chest pain or discomfort, which is angina pectoris, as a result of blockage of blood vessels in the heart, which can lead to what is called myocardial infarction or heart attack, pain or cramping in the legs, peripheral artery disease, weakness or numbness in arms or legs, especially when it affects the blood vessel supplying nerves or nerves that are essential for function of those areas. Then confusion, memory loss, or cognitive decline. Can you imagine? The swelling in the legs, yellowish patches on the skin, grayish-white rings around the cornea of the eyes, that's acroceles. The small yellowish bumps on the eyelids, and so on and so forth. Okay? But in women, fatigue, shortness of breath, chest pain or discomfort, weakness, arms and legs, mood changes more often. Then, of course, in men, erectile dysfunction, fatigue, chest pain, shortness of breath, weakness in arms and legs, so on and so forth. Of course, in adults, confusion, memory loss, difficulty with daily activities, weakness or numbness in arms or legs, especially when a cerebrovascular accident has occurred, stroke. Of course, falls are also not uncommon. So what are the causes and risk factors? I always like to use this card. As you can see, it's just an epitome of lifestyle diseases. It's an ambassador to lifestyle diseases in short. Now, genetics, because a family history of high blood cholesterol is a strong risk factor. Unhealthy diet, consuming saturated and trans fats, because our bodies find it difficult to metabolize these fats, and these fats find a way to clog up the system in a negative way. Then obesity, excess weight, physical inactivity, smoking, alcoholism, age, because the older one gets, the higher the tendency to have high blood cholesterol. The risk increases after 45 years for men and 55 years for women or thereabouts. Diabetes increases bad cholesterol directly. Hypertension moves closely with high blood cholesterol, because high blood cholesterol leads to increase in peripheral resistance, blocking blood vessels, and that makes the heart pump with a higher pressure to squeeze through that blockage. And that's why you see that like what we call 5 and 6. Kidney diseases as well. Certain medications are not left out. Being a man is also a risk factor, funnily. And then ethnicity, chronic stress, liver diseases like fatty liver disease. We can watch fatty liver disease on YouTube, on Dr. Drugs, and you see what we discussed about that. Then we have polycystic ovarian syndrome, which normally moves with metabolic diseases that we discussed earlier. Of course, menopause, because of the loss of vasoprotective capacity as a result of the drop in estrogen. Estrogen also helps to protect blood vessels and prevent metabolic conditions from happening in women. But when this drop in estrogen takes place during menopause, a lot of issues begin to emanate, and even arthritis is not left out, as estrogen is also osteo or bone protective. We talked about this in one of our topics on Dr. Drugs. See it on YouTube, titled Menopause. Complications. So apart from lifestyle diseases like fatty liver disease and hypertension, the cardiovascular complications include plaque buildup in arteries, heart attack, peripheral artery disease, cardiac arrhythmias, that's irregular heartbeats. We'll talk about that shortly. Heart failure, transient ischemic attack is not left out. Ischemic stroke, hemorrhagic stroke, cerebral vasculitis, that's inflammation of the blood vessels in the brain. We have chronic kidney disease, amongst others. Then we have cognitive decline, dementia, Alzheimer's disease, peripheral neuropathy. These are neurological complications. We have complications that happen in the eyes. You can see that evil cholesterol molecule there, which is wings and horns and tail. You can see that age-related macular degeneration, eyes, because from the name you understand that the macula, which is the most sensitive part of the retina, can degenerate with age. So you can see that this will help to facilitate that. Cataracts, glaucoma, and others are not left out. Other complications, of course, include erectile dysfunction or impotence. This is when it seems as if the downstream sector has gone on holiday. That could be terrible. Then we have gallstones, pancreatitis, reduced quality of life, economic issues, because even to handle this condition requires some money, of course. And because it leads to debilitating health conditions, you can see that it can prevent people from being able to work and make a living or earn a living. Insulin resistance is not left out, because, of course, type 2 diabetes is another way of saying insulin resistance. And then we have polycystic ovarian syndrome, deep vein thrombosis, poor wound healing, because sometimes the blood vessels supplying parts of the leg, especially the foot, can get blocked, and necessary materials that help with wound healing are deprived of that area. And you see that people, especially people that are older, you find out that when they have injuries, sometimes it's very difficult to heal, especially on the foot. Apart from diabetic foot, we're talking about cholesterol blocking major blood vessels to the feet and causing difficulty or hindering rapid wound healing or wound healing. Interestingly, the greatest enemy of a healthy heart is high blood cholesterol. And this is how it happens. This is why it leads to overweight, that gives the heart a wider region to pump blood to, hence extra work. And guess what? The heart has to increase pressure. And that is the origin of what? Hypertension, when it is sustained. It blocks blood flow in the blood vessels, leading to increased peripheral resistance, forcing the heart to pump with higher pressure, as aforementioned. It blocks blood flow to heart muscles, killing them and making them die painfully, leading to angina pectoris or chest pain that happens as a result of heart attack or myocardial infarction, which can also lead to cardiac arrest. And it also blocks blood supply to the nerves that help control heart rhythm, and that can lead to irregular heartbeats, and so on and so forth. Let's talk about high blood cholesterol as an agent of fatty liver disease. As you can see, this liver is full of fat, and this is how it happens. You see, hypercholesterolemia or high blood cholesterol leads to an elevated level of bad cholesterol. The liver cells begin to take in this cholesterol. Then the cholesterol begins to accumulate into an excess cholesterol stored in the liver cells. Then fatty substances like triglyceride begin to form. Then these fatty substances form fat droplets that begin to strangle the liver and suffocate the liver, in quote, and that leads to what is called fatty liver disease or hepatic steatosis. As aforementioned, all lifestyle diseases often share common risk factors: obesity, smoking, metabolic syndrome, insulin resistance, and so on and so forth. But bear in mind that it's also very unfortunate that fatty liver disease also leads to high blood cholesterol. Can you imagine? So they cause each other. That's why it's very important one breaks off from this cycle. There's a very strong link between cholesterol deposits as a common problem when we're talking about heart health and erectile dysfunction. Cholesterol blockage or deposits in the blood vessels that supply the entanglement facility leads to failure of the entanglement facility achieving or sustaining erection for long enough to achieve entanglement satisfaction, as is found in the cholesterol-related heart issues like angina pectoris, hypertension, heart attack, etc. Just as is happening in the upstream sector, it can also cause problems in the downstream sector. That means that cholesterol, high blood cholesterol, can actually lead to entanglement facility dysfunction, and that means that removal of this blockage is key in reversal of entanglement facility dysfunction, or ET. As you can see, a lot of people are wondering why they are not performing what they're supposed, the way they're supposed to perform, without knowing that cholesterol is quietly causing problems in there. That is why this topic is also very important to our men, especially today. Diagnosis. Physical examination. We have to know the medical history of the patient. The family history too. We have to, because if a patient is having parents that had high blood cholesterol, both grandparents from both sides also had high blood cholesterol, all the brothers and sisters have high blood cholesterol, it shouldn't be a surprise that that patient may be having high blood cholesterol. Blood pressure measurements are very important because remember I said we mentioned that they go together. Body mass index is also important because obesity and high blood cholesterol are very close cousins. Waist circumference measurements, especially in women that are around menopausal period, because menopause leads to an increase in accumulation of visceral and abdominal fat in women. Blood tests also include lipid profile, full blood counts, blood glucose tests, kidney function tests, liver function tests, and of course, imaging tests like echocardiogram to check how much damage this excess cholesterol may have caused in heart, ultrasound tests, CT scans, as well as MRI may also be required diagnosis. So lipid profile briefly is also known as a lipid panel or cholesterol test and measures the level of different types of cholesterol or fats in the blood. You see, these parameters include total cholesterol, which should be less than 200. HDL or good cholesterol, which should be higher than or equal to 60 milligrams per DL. Low density lipoprotein cholesterol, LDL cholesterol, or bad cholesterol, which should be less than 100 milligrams per DL. Then, for people that are already having this risk of having high blood cholesterol, it's often better to be left below 70. Then we have triglycerides, the fatty substances we mentioned, of course, very low density lipoprotein, or very bad cholesterol, which should be less than 30 milligrams per day. So let's just note that these parameters also have relationships with each other. That means that total cholesterol ratio to good cholesterol should be below 3.4 to 1. The total cholesterol to triglyceride ratio should also be below 1.5 to 1. These things have medical implications because they can be strong risk factors for other lifestyle diseases like hypertension, fatty liver disease, type 2 diabetes, and all that. But for best results, it's advised to fast for 9 to 12 hours before this test is also before this test is carried out. Liver function test is not left out because, as we know, high blood cholesterol damages the liver and can lead to fatty liver disease. So that's why this is important. Now, liver function test assesses the liver's ability to perform its various functions such as detoxification, metabolism, and bile production. Parameters and what they assess include ALT, AST, ALP, GGT, amongst others. But for best results, as aforementioned, it's best to fast maybe 8 to 12 hours before these tests are carried out. So if you want to know more about liver function test, we spoke more about it. We're talking about fatty liver disease and hepatitis B virus. You can go to Dr. Drugs on YouTube or any other social media is available and watch. Now we have epidemiology of high blood cholesterol. High blood cholesterol increases cardiovascular risk by 2 to 3 times. Can we imagine that? And cardiovascular diseases are the leading cause of death in Nigeria. Bear in mind that stroke and heart failure are common complications from cardiovascular diseases, which are also from high blood cholesterol, oftentimes. And you can see that 34.6% of Nigerians have high blood cholesterol, and 44.1% have borderline high blood cholesterol. We're talking about almost 79% of the population of Nigerians either have high blood cholesterol or are on the boundary or have borderline high blood cholesterol. This is according to the Journal of Clinical and Diagnostic Research 2019. You can see that it's relatively recent. That means that all these cardiovascular issues we're having in this country would most likely be coming from high blood cholesterol. And I know that these things will most likely be as a result of the common kind of foods we eat. We'll talk about that shortly. Now, 27.5% of adults in urban areas have had high blood cholesterol, and 20.5% in rural areas. It's very clear why. In the urban areas, we eat all forms of refined carbohydrate, meat pie, we eat pizza, we take ice cream, we take all sorts of things that are detrimental to our bodies. But in the rural areas, or what we call the villages, they eat more fruits and vegetables, they go to farm, they do exercise, and they do a lot of things that help them to maintain a healthier lifestyle via their diet. And that's why this statistic is actually correct. And this is from the Nigerian Journal of Medicine 2021, so it's even fairly recent. And so you can see why it's good for us to engage in proper lifestyle choices, dieting. You know, in the city, you have all sorts of fast food restaurants around, all forms of soft drinks, mineral soda, and all that. But in the rural area, we have more vegetables, fruits, and so on and so forth, clean air, and all that. And you can see the results of the test has shown the advantage of that. This man is trying to exercise, but I wish he started exercising early before he had high blood cholesterol. And prevention, of course, entails early screen and detection, because prevention is better than early detection. Lifestyle modifications, regular physical activity for about 150 minutes per week. That's the minimum of that is okay. Then, of course, we have to maintain healthy weight. That's the BMI, or body mass index, has to be within 18.5 to 24.9 kilograms per meter square. Quit smoking, avoid or limit alcohol consumption, manage stress. Of course, dietary changes, for instance, like engaging in diets that resemble or look like the Mediterranean diets, considering the economic condition of today. I'm not sure, but whether everybody can afford the Mediterranean diet, but at least let's have an idea of where we are going to. Then we have to eat a heart-healthy diet, choose lean protein, limit saturated and trans fats, increase fish and nuts, limit dietary cholesterol, eat more soluble fiber-rich foods. Then we have to eat less processed meats and so on and so forth. We have to tackle other risk factors for high blood cholesterol, exercise regularly, get regular checkups, family history assessment. Somebody said that if you want to know how your wife will be, go and look at your mother-in-law. That means you have to check and see if every other person is having high blood cholesterol around, you should double up in your activities to make sure that you don't have. Then lifestyle counseling is important. Medication adherence for those who already have high blood cholesterol, regular follow-ups, follow-up appointments, and use of natural pharmaceuticals, which is super, super, super important. To find out why shortly. But let's bear in mind that tackling other risk factors is super important. Like we're talking about type 2 diabetes, obesity, fatty liver disease, and all that. We have videos on these on the drugs on YouTube. You can go and check them out and see how cholesterol actually has a strong link with them, and they have to go anytime we want high blood cholesterol to go, if they are there. Ladies and gentlemen, this is an amazing picture. I like showing this picture all the time because we don't see any Hennessy, we don't see any Moët, we don't even see any Baileys, Azul, Semoris, Benson, dry gin, and other unhealthy things that we consume. There's no pizza here, there's no shawarma, there's no, even white bread, the regular white bread we have is not even here. This looks like that kind of bread that has very low glycemic index. All we see here is what I call all things bright and beautiful. This is what we should eat like if we want to avoid high blood cholesterol. Now, management and treatment. The treatment goals are very simple. Lower low density lipoprotein of bad cholesterol to 100 milligrams per DL or less. Then we have to raise the good cholesterol that helps to save the day by increasing it to 60 milligrams per DL or more. We have to lower triglycerides of bad fats to 150 milligrams or less. That's 150 milligrams per DL or less. Then we have to achieve total cholesterol of less than 200 milligrams per DL. But how do we achieve this? Regular physical activity, maintaining healthy weight, quit smoking, stop alcohol consumption, in this case, stop. Manage stress, have a healthy heart diet, like the Mediterranean diet as aforementioned. Chemical intervention or medications, for instance, the statins we talked about when we're looking at the pathway for cholesterol synthesis. You see where the statins block the production of cholesterol by hindering the production of mevalonate, which is a precursor of cholesterol. We saw that earlier. And others we'll discuss shortly. Surgery is often important when the cholesterol has led to terrible complications like those that can happen in the liver, or sometimes people may need liver transplantation. Of course, monitoring and follow-up is very important. The natural pharmaceuticals, which are amazing because of their absence of side effects. So what are the challenges in the management of high blood cholesterol, not fatty liver disease, sorry. Now, late detection is a problem. Self-medication, poor patient compliance is also a problem. Then self-medication has a lot to do with what I call Sabinus, that's people overknow. Rather than take the matter to a professional, they want to manage it themselves and hence they find themselves in trouble. Then we have poor health infrastructure, no insurance, lack of trained health practitioners. In fact, I know a country that is among the highest exporters of health practitioners as we speak. Then we have economic challenges, poor health information and awareness system. People don't know why it's important to even check their cholesterol level. We have resistance to change as old habits die hard. Fake medication is not left out. Depression can discourage people from actually managing these conditions because they've been trying all sorts of things and it's not working. Probably they've been doing the wrong thing without knowing. Drug side effects, we'll talk about that shortly. Then poverty and high cost of treatment is another issue. Chemical drug side effects, just mentioned that earlier. And then predisposing staple foods, because in this part of the world, we eat carbohydrates a lot. And that's one of the reasons why people end up having these issues. So talking about chemical interventions, you see statins are not left out because most people take statins as the go-to drug. Whenever they just say high blood cholesterol, they give statins. But they are not bad in terms of taking people out of danger, as they help to lower low density lipoprotein and all that. These are a few examples of the statins we have: atorvastatin, simvastatin, rosuvastatin, pravastatin, rovastatin, and so on and so forth. Then we have bile acid sequestrants, fibric acid derivatives, even niacin is not left out. Then we have the proprotein convertase, subticillin or kexase type 9 inhibitors. These hinder the overexpression of bad cholesterol receptors in the liver. And that is very important. Then we have cholesterol absorption inhibitors, we have bile acid synthesis inhibitors, and we have ATP citrate lyase inhibitors as well, and so on and so forth. But of course, these chemical drugs, they help in one side, but the problem is that they also have side effects that we need to also be aware of. I'm not saying that you should disobey your health practitioner, but follow the rules and regulations and do not overuse these things or use them beyond what the prescription that was given to you says. For instance, these statins people chew like chin-chin causes muscle pain or weakness or myopathy, liver damage, you can imagine, abdominal pain, and so on and so forth. Even increases the risk of diabetes and others. Then you can see that bile acid sequestrants have their own side effects, fibric acid derivatives, and so on and so forth. These are just a few of the side effects that it can cause. Now, what is the importance of tertiary pharmaceuticals in the management of high blood cholesterol? Well, they help to prevent high blood cholesterol in the first place and improve lipid profile, resolve other lifestyle diseases that are risk factors, like type 2 diabetes, fatty liver disease, obesity, and all that. They regenerate and rejuvenate damaged body tissue due to ischemia or blood supply blockage by cholesterol aggregate. Then prevent and resolve inflammation, destroy free radicals that damage DNA, detoxify the liver and the body from bad cholesterol. Then they achieve effective weight management that will not lead to rebound weight gain, that should not lead to rebound weight gain. That's after the weight management program. You shouldn't have rebound weight gain unless one goes back to the reason why the person had excessive weight in the first place. Then, of course, they support gut health and digestion and tackle other comorbidities that may coexist with high blood cholesterol, and so on and so forth. Now, what we're talking about here is mostly the active ingredients. I'm not saying that you must use these products that you're seeing here. I suggest you focus on the active ingredients, and wherever you can get good sources of these active ingredients, you can go ahead. But what I use for my own patients are these products you're seeing here. I use Forever Living products because I don't have time for stories. They've been here for heading half a century, and their quality is undisputed. So I don't have time for is it going to work kind of thing and all that. And they assist or help. So they are not to replace the prescriptions that we have given to you, but these are to assist to ensure that this high blood cholesterol goes once and for all. They're to help. And for instance, cardio health contains coenzyme Q10, lecithin, magnesium, and so on and so forth, which help to counter high blood cholesterol, regenerate and rejuvenate the heart, the lungs, the liver, which plays a very, very vital role in cholesterol metabolism in the body, and the kidneys. And help to supply energy by assisting mitochondria or cell powerhouse activity. Then they help with the treatment of hypertension, stroke, and renal artery stenosis, which just means renal artery blockage, probably as a result of cholesterol aggregates that may lead to a lot of issues in the kidneys and other ailments that can cause or are provoked by high blood cholesterol, etc. We have garlic thyme. This contains garlic and thyme extracts, lecithin, which help as antioxidants, anti-inflammatory, which have antioxidant qualities, anti-inflammatory properties. They have cholesterol metabolism regulation capacity. Of course, they help to prevent high blood cholesterol from accumulating in the blood, help with insulin sensitization for people that are already having type 2 diabetes, and of course, the antioxidants give DNA protection from free radicals. This Arctic Sea contains eicosapentaenoic acid and docosahexaenoic acid, which help against inflammation, prevent cholesterol and fatty substance aggregation, resolve cardiovascular complications. Of course, we know why that's important, because high blood cholesterol or hypercholesterolemia causes cardiovascular complications as well as cerebrovascular complications, and help to resolve other associated lifestyle diseases and counter hypercholesterolemia. But let us bear in mind that they are essential fatty acids and have a lot of functions. Even children that have intellectual disabilities like autism need them, stroke patients need them, because they're very essential for proper brain function, as well as a lot of other things that EP and DHA can do. Then we have Lycium Plus, very powerful antioxidants that contains Lycium barium or goji berry extract. Of course, it's a powerful antioxidant and protects liver cells from damage. Remember, the liver is a very vital organ with regards to cholesterol metabolism. And then we have rapid recovery from ailments provoked or caused by hypercholesterolemia. Eye vision is not left out, because we mentioned that this high blood cholesterol could damage the macula of the eyes or worsen age-related macular degeneration. And that is the reason why this product is super important. In fact, I bumped into a prescription of this medication from a hospital not long ago. So it's even actively being prescribed by ophthalmologists and eye health specialists. And because it's just so amazing when you're talking about age-related macular degeneration, prevention and management. Of course, it helps to maintain good eye health. And of course, it's very useful in cases that have to do with glaucoma, cataracts, etc. It's very popular. But the problem is that sometimes it can be a bit scarce, but it's super, super important for eye health. Forever fiber is not left out, because we know that soluble fibers help with good cholesterol levels in the blood and also help to improve lipid profile as well. Of course, they contain soluble fibers that help reduce blood cholesterol from the gut, improve gut health and digestion, and counter hypercholesterolemia, among others. Then we have this product is also amazing because the L-arginine in Argic Plus leads to the production of nitric oxide, which is a potent vasodilator that allows the blood vessels to get wider and allow freer flow of blood. Of course, you know that high blood cholesterol leads to blockage of these blood vessels. And that's why you see this is very, very important. But guess what? It also boosts muscle growth, which helps resolve weakness associated with paralysis after a stroke that has been caused by high blood cholesterol. So you see that it's also very important in that aspect. And of course, as a bonus, it also improves blood perfusion to the entanglement facility, that's the downstream sector, and can help to reverse erectile dysfunction that may result from high blood cholesterol. So you can see it's very, 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 very important. In fact, these amino acids that help with muscle growth can also help to counter what is called sarcopenia, which is the loss of muscle mass as people get older, and so on and so forth. And of course, you know that there's what we call disuse atrophy. That means any part of the body that is not being used begins to disappear. You understand? And you see that these muscles that are in that area, they can begin to maintain their integrity when they have biomolecules like this. And that's why it's important that these amino acids, which are the building blocks of proteins that are the major component of muscles, are very, very important. Now, this product is something that we cannot finish talking about it in one day. So let's just talk briefly about it. It contains a miracle substance that I don't even know how to describe it, because there's always something it can do for the body. Do you know that this product has been in existence for more than 3,000 years? People have been using it from time immemorial. Now, aloe vera gel contains these ingredients: aloe aloe, antioxidants, and so on and so forth. But of utmost importance is its ability to trigger somatic stem cell healing. That's why it's a somatic stem cell stimulant. That is very, very important, especially when the cholesterol blockage has led to damage in tissue and in cells of the body. And of course, these things it contains help improve heart, brain, liver function and health. They are immunomodulatory, anti-inflammatory, they have antioxidant qualities, regeneration and rejuvenation, as aforementioned. Then improved insulin function as well in cases of people that have type 2 diabetes, improved gut and digestive health. Of course, they also help to reduce high blood cholesterol and, of course, improve lipid profile. This is a 9 days weight loss and detoxification program. Clean 9 is designed to reduce caloric intake and increase caloric expenditure systematically via the use of low-calorie diet plan, exercise, autophagy, that is therapeutic fasting. Take note of this terminology, is very, very important. And natural pharmaceuticals as well, while ensuring adequate nourishment. It systematically includes intermittent appropriate fasting that helps detoxify the liver. This is what we call autophagy, and of course, is part of what I call professional weight management. I'm not talking about malnutrition, because a lot of people make the mistake of engaging in malnutrition, thinking that it is the best way to reduce weight or manage weight. Of course, that will lead to shriveling or damage of the cells of the body and lead to further complications. Now, generally, it helps against other lifestyle diseases that promote high blood cholesterol, like type 2 diabetes. Ensure weight loss without damage to the liver tissue, prevent and tackle high blood cholesterol directly, removes fats or cholesterol deposits from fatty liver, hearts, peripheral blood vessels, without causing malnourishment, as I've mentioned, and so on and so forth. If you want to know more about this, go to Dr. Drugs on YouTube and watch lifestyle modifications, weight management, and detoxification, and you know more about this. So before I go, I want to leave us with this. Let's bear in mind that you are what you consume. There is a constant battle between factors that repair and protect our bodies and those that break it down. So we just have to be on the winning side. Also, let's kindly remember not to adjust medication and dosage without the guidance of trained health practitioners, as this could be very bad. Prevention is also better than early detection. It's better to prevent the problem than to begin to solve it. With that, I'll say thank you for coming and remain blessed. Hope to see you on Sunday, where we'll be talking about kidney stones. Bye.